Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Rabbyya Kausar from University of Lahore Sargodha campus. Welcome to Second International Brain and Biomedicine Conference IBCC 2024. Here I am representing my research paper Effects of Moderate Physical Activity on Hemoglobin Level and Psychological Well-Being in Females, a randomized controlled trial. So there is a background of my topic that physical activity reduces mortality and prevent many chronic diseases. It can also promote healthy cognitive and psychosocial function. It is also important to understand the moderate physical activity affects hemoglobin level. So the objective of my study is to determine the effects of moderate physical activity on hemoglobin level and psychological well-being in females. So there is a methodology that how I collected my data. I'm using a non-probability convenient separate procedure. The total participant was 70 participants, but the 30 participants were meet the inclusion criteria. The participants were randomly basically assigned into two groups, experimental group and control group. Each group have 15 participants. The experimental group were given 30 minutes of brisk walking, that is moderate physical activity along with warm up and cool down exercises before and after the intervention. The duration of the intervention was 5 days per week, still at 6 week, continuous weeks. So, however, the control group were advised to continue the routine activities. The data was collected a baseline and post intervention after the 6 weeks. But one participant from the control group was not appeared and was excluded in the post assessment due to the loss of follow up. So it is a Kausar diagram in which I described the total participant was 70 participants and 40 were excluded just because of no meeting the inclusion criteria and declined to participate. 10 participants were declined to participation in the research project. But the total participants were 30 participants who are randomized into two groups. One is experimental group and other is control group. In experimental group, the total participants were 15 participants, and in control, that is 15 participants. At the time of follow-up, there is no loss of participants from the experimental group, but there is a loss of one participant from the control group, and that analyze the data from the experimental group is 15 participants, but from the control group there is 14 participants. Uh, but in at the baseline of the data, from the participants, getting the participants from the demographic data, the that is the age and BMI, and the BMI is divided into the four group that on the basis of Asian Pacific cutoff points, and weight, in which weight is weight in kg and the height in meters per square. But our outcome measures were hemoglobin level and psychological well-being. The HB level was measured through hemoglobin level test, and psychological well-being was measured through perceived stress scale. The assumptions of parametric tests were made. Thus, for within the group analysis, pairs sample t-tests were used, while for between the group changes, independent t-tests were used. The level of significance was set less than 0.05, and SPSS version 22 were used to analyze the data. This is a figure which shows the frequency distribution of BMI. There is a three cut points. One is healthy weight, second is overweight, and third one is obese weight. In healthy weight, there is 11 participants and age group between 18 to 22 years old. And in overweight, there is 6 participants which lie in the 23 to 24-year age group. And in obese, there is 12 participants which is less than 25 years old. This is a result, and these figures shows within group changes in hemoglobin level and perceived stress. In experimental group, 15 participants, which are 15 participants who showed more significant result than the control group. And this is a comparison between the experimental group and the control group at the pre and post test. This figure shows that experimental group have more significant result than the control group. The purpose of my study was to determine the effects of moderate physical activity on hemoglobin level and mental health. And according to the result of the study, moderate physical activity, that is a brisk walk significantly improved hemoglobin level, mental health, measured perceived stress scale after the 6 week of intervention. In a recent study, moderate physical activity significantly improved hemoglobin level in blood, which is in coherence with a previous study, which demonstrated the brisk walk for long duration improved hemoglobin status. Previous study reported if a person is involved in a physical activity and muscles work to manage the deficiency and balance the need of oxygen. Therefore, the capability of muscles leads to improved oxyhemoglobin that increase hemoglobin concentration. Another study also reported the physiological responses such as exercise induce a condition of hypoxia, which increase the production of transcription factor. Thus, this mechanism leads to the excessive transportation of oxygen the blood through the erythropoietin mediated erythropoiesis. Another study reported that aerobic exercise increase the hemoglobin concentration and hematological factor in young females. Basically, the increased hemoglobin lead to increased oxygen carrying capacity and maximal oxygen capacity, that is the VO2 max. And this is because the network our cell will need and more oxygen when doing activities. So there is adaptation in binding oxygen in the blood. Another study conducted on sedentary women, it suggests that exercise reduce the red blood cells hemoglobin moreover and hematocrit in a sedentary women. Moreover, the result of recent study showed no significant improvement in mental health measured on perceived stress scale after the 6 week of intervention of moderate physical activity. But my study, the previous study contradict my study in which brisk walking improves also psychological health, because psychological health can be improved by improving cognition and reducing depression and anxiety. However, my study didn't improve the exact mechanism of mental health. So it is associated, but it is associated with the neuroprotective effect of exercise. So moderate physical activity has a positive impact on mental health, and it lowering the stress through the production of endorphins. And as we all know that endorphins elevate the mood to the increase of serotonin and dopamine, and they both have regulate the cortisol. So long term psychological benefits, social engagement, mind health, mind body connection, improved sleep quality, and cognitive performance are all observed. But the limitation of my study is that the study was a pilot study with small sample size, and it is also single centered, which limits generalizability. So however, there is also variation among the participants regarding the BMI. So it can be interact as a confounder, may affect the result. The conclusion of my study that it observed the increase in hemoglobin concentration in the experimental group suggests the intervention had a positive impact on the hematological parameters. So there, but since there were no significant differences in perceived stress level between the experimental and control group, there is a need of more comprehensive study to better understand and underlying the reasons impacting these outcomes, and considering the reported observed changes in stress level and hemoglobin level. Thank you so much, IBBC 2024. Here, I am very thankful to my supervisor, Professor Dr. Kausar Ahmed, who always guided me and made my academic journey successful. Thank you so much.